Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with fully occluding earwax in their left ear and semi-occluding earwax in that which was their right ear. And their partner is a big YouTube fan, and the patient advised that his partner watches my videos almost on a daily basis to try and get to sleep at night. It soothes, relaxes her, and she finds it very satisfying. And the patient did admit to me also that he's beginning to enjoy watching the videos himself. He's finding it very satisfying. So they made quite a long journey today to visit the clinic, and the patient's been suffering from a blocked left ear for the last few weeks, also experiencing some otalgia, which is the medical term for ear pain. They had been using some drops, which they found exacerbated their symptoms. So when you use ceremonalotics, which is the name given to earwax softening drops, they can actually short-term make your symptoms worse, and that's because the wax plug can absorb the drops and expand and swell. With sodium bicarbonate drops and hydrogen peroxide drops, what happens with those? They release water, and the skin cells that form the wax plugs, so 60% on average of a wax plug is dead skin cells. They're hydrophilic, they absorb all the water, causing the skin cells to swell, expand, which can cause the size of the wax plug to get larger and compress against the canal walls even further. So, and with olive oil based drops, what they do, they just add another lacquer of the wet matter that forms earwax. So 60% of earwax is dead skin, so dry matter, and 40% is wet matter. So a combination of sebum, which is an oily fatty substance, and also an oily sweat secreted by the ceremonous glands, and that's the 40% wet matter. So the olive oil spray of drops can add another lacquer which binds on top of the dry matter. Think about the dry matter like meshwork. That's the scaffolding. That's what forms the matrix, the structure of the wax plug, and the wet matter fills in those gaps in between all the dead skin cells and loose hairs and debris, whatever may have entered the ear, really. So I've just put some olive oil spray into the ear. Sometimes when you use drops for too long, the wax plug becomes very soft and mushy and glutinous, which is what's happened here. It's very sticky, very moist, very glutinous. Sorry for anyone's having their dinner, but I would compare this to a mashed potato consistency. And what olive oil does, it helps to bind that wax plug together. It changes the consistency, and you can see it's almost binded this wax plug. It's coming out in a larger chunk. So this is just near the entrance now, and I thought that was all the wax initially, but when I went back in, there's still quite a lot of wax in there. So there's another plug here that I'm going to remove, and it's enveloped with some dead skin. If you wait till the end, you'll see the still image. In fact, you can see the dead skin here now, this white silvery matrix enveloping the wax plug. Now, this is going to be a bit, it's going to have some residual sticky wax. It's just staining. There's going to be some on the eardrum, but it's non-significant. When you've got a consistency of wax like this and you've been using drops, you can see it's going to stain the canal wall and the eardrum. I did hover over the eardrum. In fact, I kissed the surface of the eardrum with the fine end, and some of it came away, but some of it's still there. It's not significant. We're not going to wash it out in any way. It's not going to cause the patient any symptoms. Performed tympanometry, which is a middle ear function test, and the eardrum was moving absolutely fine. So you can see the majority of the eardrum there. Even at this stage, the patient's able to hear. So if we left this behind, it's not a problem. But I'm just trying to see if anything that comes away easily. So a bit on the drum there. And there's some on the anterior canal wall. For me, the anterior canal wall, the front part of the ear canal, is the most sensitive. So this is the region you're going to be really, really gentle with. So nice little plug there. And you can see that it's almost like loose stool consistency created by, and no doubt that's created by the drops. So I suspect this patient it's been using hydrogen peroxide drops. They weren't sure which ones they were using, but it's either hydrogen peroxide or sodium bicarbonate. It's definitely not olive oil. It doesn't have that property. It doesn't turn wax into this consistency. So I'm just going to go back. I'm just using the fine end. The ear's unoccluded now, so they're able to hear very, very well. And here's when I just kiss the surface of the eardrum. It comes away, brilliant. If not, not a problem. And right on the anterior part of the eardrum here, this is the front section, about 9 o'clock. Now, I know some viewers may think, oh, you've left that behind, but sometimes trying to remove every little last speck of wax is going to cause more problems. And if it's not causing any symptoms, then you leave that. That residual wax, it's just because the patient's using so much drops and it's really glutinous and it just sticks to the canal, side of the canal walls. Again, at the end of the video, if you watch the still image, you'll see some staining on the tissue. So when we put the wax plug on the tissue, because it's so sticky and mushy, it stained the tissue. That's all it is. This patient's ear anatomy is quite interesting. You enter the ear and there's quite a inclination in the floor of the ear canal wall, so it's inclined upwards. Now, most of our ear canals are around 30, 32 degrees. This is a bit more than that. It's probably about 45 degrees actually. So there's a bit of a mountain peak here that we have to go over. Just using the Jobson horn. I'm just because on the cartilaginous portion, the outer third, the cartilage is not as sensitive as the bony part of the ear canal or the eardrum. So I'm just mopping away any of this sticky wax that's caught the side of the ear canal as I was extracting it. I'm just going to re-enter the ear to visualize the eardrum. So that's the blue disc. Hammer bones there in the center. Now, their right ear, the consistency of the wax was completely different. It's a bit glossy there, so for me this has got a higher content of dead skin. Dead skin keratin has got this glossy effect when you shine light against it. So I'm just using the Jobson horn. There's a large gap there that I can go over the top. But this was quite strongly adhered to the floor of the ear canal. And I'm just going to be careful. I don't want to be spreading this wax like butter on a slice of bread or toast. So we're going right behind it and I'm just slowly leveraging it out. Got to be wary that the tip of the Jobson horn is not grazing the floor of the canal wall as I'm bringing it out. And a large plug there. So this patient's eardrum is intact, it's visible. The eardrum looked quite thin and initially I thought it may be retracted. So when I mean retracted, collapsed inwards, and that's caused by negative middle ear pressure due to a blocked eustachian tube. It's when the middle ear is not ventilated, it creates a vacuum effect and the eardrum can get pulled in. There's appears to be some tension on the eardrum and the attic region, and we can see the patient's incus, more specifically the long process of the incus, and sometimes that's a sign that the eardrum is retracted, but perform tympanometry. In fact, the left eardrum was just as well as the right. There's no difference there. That's the wax and dead skin from both sides. You can see on that tissue that staining I was referring to. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.